Hello everyone, welcome to medVision. Have you ever looked at a chest x-ray and feel completely lost? Don't worry. By the end of this video, you will be able to identify every major structure like a pro. Today, we are going to learn chest x-ray anatomy in a systematic way, just like a radiologist do. I will go step by step from top to bottom, covering the airways, bone, lungs, heart and diaphragm. So let's get started. In this video we will divide chest x-ray anatomy into 6 simple sections: the upper structures, the airways, the lungs, and the helium, the cardiac shadow, and the diaphragm, and the costophrenic angles. So follow this sequence and you will never miss anything on x-ray again. So upper part. In upper part we are covering about the apex, clavicle and ribs. Start from the top. First look at the lungs apexes. These are the most upper part of the lung, just above the clavicle, and this is our clavicle bone. And the above clavicle, the above part is called apex of the lung. Primary evaluate the apex of the lung and next identify the clavicle, and this should be symmetrical, and this will help you to judge if x-ray is properly aligned. Now looking for ribs, and the posterior ribs and the anterior ribs. Posterior ribs are more horizontally and clearly visible. These are posterior ribs, and you can see on the left side the ribs are slanging downwards. These are called anterior ribs. Most important, counting ribs are also help assessing inspiration adequacy. Normally you should see around 9 to 10 posterior ribs. Next we looking for airway. In airway we consider as trachea and the carina. And now move to the center, and the trachea should be in midline or slightly to the right. If it is dilated, it may indicate pathology. Follow the trachea and downwards. It divides into two parts. The point where it is divided is called carina. This point is carina and divided into two most important structures, and that is right main bronchus and that is left main bronchus. Always remember the carina is an important landmark. It lies around the level of T4 and T5 vertebra. Next important is examine the lungs. Each lung divided into 3 zones, the upper zone, the middle zone and the lower zone. Comparing both sides, they should be equally dark, and looking for any opacity, consolidation and the asymmetry. And also identifies vessels more prominent near helium and fissures, sometimes visible. And the right lung is divided into 2 fissures and 3 parts. It divided from the fourth rib, and the upper part, the middle part and the lower. Next, focus on helium. Each lung has a helium where the bronchus, bronchi, pulmonary arteries and veins enters and exit. Normally the left helium is slightly higher than the normal. It should be not too bulky or asymmetry. Enlargement also suggests lymphoadenopathy or vascular issue. Next, we observe the cardiac shadow. And the cardiac slot should be occupy less than 50% of thoracic width in normal PA view. Identify borders: the right border, right atrium, the left border, left atrium, the aortic notch, pulmonary arteries, and check for the size enlargement of the shape abnormalities. Now checking for the diaphragm and the costophrenic angles. This is the part of diaphragm and the angles formed, that is called costophrenic angles. And usually you can see the right dome usually slightly higher than the left dome, and due to presence of the liver. Costophrenic angles are very sharp. If the angle are not visible, some pathological pleuroeffusions condition may occur. So this is the systematic order to evaluate X-ray and top to bottom, the apex and clavicle, trachea, lungs zone, Hilum, and heart, and the diaphragm. If you found this helpful, don't forget to like, share, subscribe for more radiology and physiotherapy content, and also comment below what topic should cover next. Thank you for seeing the medVision.